for them to have better health, but then also they impact our program in such a way that it helps us grow. And so I find it just completely rewarding. And I always say this to people, I can't even believe I get paid to do what I do, because really I consider the patients that I work with like family.
A collaborative model is really the only model that makes sense. If people choose to practice in isolation, they're missing their opportunity to provide better care.
We are essentially moving into a model where we are including pharmacists in all the different sites, because we are developing patient-centered medical homes, and so the pharmacist is becoming a really critical element in the patient-centered medical home. Really having the other providers look at us as experts in that team.
Having the time to spend with the patient, making sure that they understand their diagnosis, just gets them that much more engaged and able to get to that final goal. Any provider, they can spend time with the patient and know what the goal needs to be. Until you truly have engaged the patient in it, you're only going to get to a certain point.
Helping people and empowering people to manage this disease effectively really gets back to quality of life. And whatever we can do now to work with families, to empower the families to understand better so that the future generations maybe have a chance of not becoming diabetic, is really extremely important. Probably one of the most powerful ones that Sandra shares was an early on patient for her, a Yaqui tribal member who was scheduled for an amputation because of the ulcers on his foot, whose fellow tribal member told him before he had his leg amputated he should try to get in over here, the clinical pharmacy program, which he did, and through education and correct med management and compliance with med management, he was, his foot was cleared up within several months, and he's a security guard with both legs.
Definitely growing our service has been a success, making sure that we're being able to share or offer pharmacy services to more and more patients. And that's very, very important to me. We've been growing from different sites. We've seen tremendous improvement in patients' health outcomes. So we have documentation of improving A1Cs, of improving our ability to document that we are meeting the standards of care for diabetes. The way we're set up is, it's an open door policy. Literally, people walk into my office, they ask questions, they're able to get whatever they need immediately. We give the patients our direct phone numbers, which is super helpful because people can solve their problems quickly versus, becoming a situation where they have to go to an emergency room or wait 2 to 3 days before they get a call back.
Why utilize a physician to do something that a clinical pharmacist can do, especially if many times you think a pharmacist can do it better, okay? There's a lot of medications out there, a lot of new medications, a lot of interactions between meds, and who better than to be able to look at those and be able to say, oh yeah, there potentially could be a problem there. Those are all types of things that impact us all and are not just physician or pharmacy, but they're things that we need to be discussing together to see how do we improve patient safety overall.